Hi guys, my name is Greg Johnson and I'm a physical therapist here at Mountain Physical Therapy in Kalispell, Montana. I just wanted to share with you a few of the most common gait deficits I see as a physical therapist. One of the first deficits I see is pelvic instability. Having weak trunk muscles can cause the hip to drop or rotate when you're standing on one foot. The second deficit I see is hip weakness. Having lateral hip weakness will also cause the hip to drop when you're standing on one foot. Having weak posterior glute muscles is going to decrease your hip extension strength, which is going to limit how far you can stride when you're walking or running. Tight hip flexors are also a problem after we sit for a prolonged period of time. It'll place your pelvis in an anterior tilted position, which causes an increase in lordosis or in an extended position. The last deficit comes at the ankle. If you have a stiff ankle, whether it's having surgery in the past or previous ankle sprains, stiff ankle dorsiflexion, or bringing your toes up towards your shin bone, will cause an early heel rise as you step through in your gait, which will result in a decreased stride length. The other thing I see with the ankle is overpronation, or having your arch collapse. Now, having your arch collapse is going to result in your knees going to the middle, or what we call knee valgus. This is going to put unnecessary stress on your knee over a repetitive amount of time. So I want to give you guys some exercises to work on hip stability. I have Nate here. He's going to stand on the step with his right leg and his left leg is off. He's going to keep his right leg straight, and he's going to drop his left hip down, and then he's going to scoop and lift his left hip up. We're actually working the right side hip muscles. Those muscles are helping to scoop up. Try and avoid using your left trunk muscles or bending the knee. You should feel it on the outside of your stance leg. This exercise kind of helps to strengthen the glute medius in a closed chain position. This really helps to carry over in walking or gait. So this next exercise is a single leg stance exercise using a band. So what Nate is going to do is hold the band in his left hand. He's going to turn to his right, wrap the band around his shoulders, and then he's going to stand on his left leg. You're going to want to keep the band and the stance leg on the same side. What this does is the band is going to twist his body, and it's going to cause the hip to go into internal rotation. So his job is to externally rotate, keep his shoulders and his hips square and aligned facing forward. This is going to work the hip external rotators. As he stands here, his ankle, knee, hip, trunk, they're all working in kind of unison to work on stability. So using a time frame, you can challenge yourself and see how long you can hold it for. You can challenge the surface you're standing on. I hope these exercises help you and improve your hip stability. Now, these are just a few of the issues we see with the gait cycle. If you want further information, you can contact us at mtnpt.com, or you can contact Ryan and his crew at engagefitnessmontana.com. Thanks for watching.